Hello, my name is Melissa Baglu, and I'm an assistant professor of clinical surgery at Columbia University College of Physicians and Surgeons. Today I'm going to be discussing with you diseases of the gallbladder, their management, and treatment options. What is the gallbladder, and what does it do? The gallbladder is a small, pear-shaped sac that's located under the liver and functions to store bile. Bile is actually made in the liver and functions to help absorb fats that are ingested and absorbed through the intestines. The bile is carried from the liver to the gallbladder and then into the intestines through small tubes called the bile ducts. The gallbladder actually stores the bile and releases it into the small intestine in larger quantities after a meal is consumed. This allows for breakdown and absorption of the food contents. What diseases are associated with the gallbladder? Gallstone disease is very common and is one of the leading indications for surgery in the United States. 10 to 20% of the population will actually develop gallstones at some point in their lives. Gallstones are collections of solid material that form inside the gallbladder. They are usually smaller than 1 inch or 2.5 centimeters and can be single or multiple. There are two major types of gallstones: cholesterol stones and pigment stones. Cholesterol stones are usually formed when there's an imbalance between the amount of cholesterol and bile in a patient's system. This leads to sludge formation in the gallbladder, which then crystallizes into stones over time. The various diseases that the gallbladder can develop, usually due to gallstone formation, is Chololithiasis, or gallstones in general, Chololithiasis, which means that there's a gallstone that's located now within the gallbladder ducts as opposed to just within the gallbladder, Cholecystitis, which is an inflammation or infection of the gallbladder, cholangitis, which is an infection or inflammation of the bile ducts, pancreatitis, which is inflammation of the pancreas secondary to a gallstone, gallstone ileus, which is an obstruction of the intestines, which is caused due to gallstones, biliary dyskinesia, and gallbladder cancer, which I will talk about in more detail later. What are the risk factors for development of gallstones? The most common risk factors are age, female sex, genetic predisposition, obesity, and rapid weight loss. Pregnancy is also a condition which can lead to formation of gallstones. As you can see on this slide, there are multiple other causes of gallstone formation, and that's why it's one of the most common diseases that we have within our society. What are the symptoms of cholelithiasis or gallstones? Well, most commonly, gallstones are silent and don't actually cause any symptoms. In this situation, there's no need for treatment of the gallstones. In fact, some people live their whole lives with gallstones, which never causes any problems and may incidentally be found on CAT scans or studies that are done for other reasons. Symptomatic gallstones do need treatment. Often, the symptoms that are experienced are abdominal pain that can either be in the right upper quadrant, which as you can see on the slide the location of, the epigastric region, and it can radiate to the right shoulder. Nausea, vomiting, and actually bloating are symptoms that are commonly associated with gallbladder disease. If there's an infection, patients can have fevers, and if there's an obstruction of the bile ducts because of the stone, this can lead to light-colored stools and dark-colored urine and jaundice or yellowing of the skin. The symptoms of abdominal pain, nausea, vomiting, and bloating usually occur after intake of a fatty meal, which stimulates the gallbladder and causes the symptoms to become apparent. How do you diagnose cholelithiasis? Well, most commonly an ultrasound is used to diagnose the presence of stones. This is a safe, non-invasive study that's painless to complete and uses high-frequency sound waves to identify the gallbladder and the gallstones. Here you can see what a normal gallbladder looks like, and when there's a gallstone in position, what that appears as on an ultrasound. There's no radiation used for this exam. We can also use what's called a Hyda Scan. This is an imaging procedure that helps track the production and flow of bile from the liver into the small intestine. It's a nuclear medicine scan that is also safe and non-invasive and painless. It, however, does use a small amount of radiation as a radioactive chemical that's traced from its production within the liver through the bile ducts and into the gallbladder, and then when it empties into the duodenum. If it empties appropriately into all of these structures, we know that there's no underlying blockage of the bile ducts or the gallbladder. However, if one of these is abnormal, the study tells us where the process of disease is. In order to diagnose gallstone disease, we can also do magnetic resonance imaging, or an MRCP, which is a special study that uses magnetic resonance imaging to visualize the biliary and pancreatic ducts. This allows for better imaging of the anatomy and a more intensive view of the structures. Here you can see in the pictures to the right, the gallbladder is pointed out, and within the gallbladder is a stone that can be identified on MRCP. This gives us a better idea of the anatomy of the gallbladder and the bile ducts. We can also do ERCP. This is an invasive study that is also safe and painless, that can not only diagnose biliary disease, but it can also be used as a therapeutic option. It's completed by completing an endoscopy, which allows entry into the intestines through the stomach, as well as entry into the bile ducts to allow for imaging. In the pictures here, you can see that stones are pointed out on the picture on the bottom left side of this screen. Here you can see stones within the bile duct. A sphincterotomy, or an incision within the sphincter between the bile ducts and the intestine, can be completed to allow for retrieval of these stones. This will allow a less invasive approach than a surgical approach to remove stones from the bile ducts. Thank you for listening, and if you have any additional questions or would like to schedule a consultation, please don't hesitate to call us at our offices here in Columbia at 212-305-9506.